Hello friends, welcome to Green PG YouTube channel. This channel will discuss about high yielding and most repeatedly asked questions for those who are preparing for medical PG entrance. If you didn't subscribe our channel so far, please do it and click the bell icon next to it to receive notifications. Feel free to click the like button and share your comments. Today we will discuss a small topic, intraocular foreign body. Let's have a look into various foreign body based on their severity. First, we will look into the foreign body that can severely affect eyeball and vision. Magnetic substances like iron, steel, tin, and non-magnetic substances like copper and vegetable matter are the foreign bodies that severely affect eyeball. Whereas magnetic substances like nickel and non-magnetic substances like aluminum, mercury and zinc have only a mild impact on eye. But there are some foreign bodies which have no effect on eye. Let's have a look into that inert foreign bodies. They are carbon, lead, glass, gold and stone. Most severe magnetic foreign body that can affect the eye is iron. Intraocular retention of iron foreign body will lead to pigmentary and degenerative changes in the eye. That condition is called as siderosis bulbi. Most common non-magnetic substances that can cause severe impact on eye is copper. That condition is called as chalcosis. Thank you very much. Now guys, please answer this simple question. Which among the following is an inert material that can be left alone in eye? Option A, iron. Option B, lead. Option C, nickel. Option D, copper. Yeah, that's it guys.